Chapter 7: Understanding Options. One of the most challenging and pivotal aspects of early pregnancy is understanding the options available and making informed decisions about the future. For young women like Maya, who discovered she was pregnant unexpectedly, this stage brings emotional, ethical, and practical considerations. Knowledge and guidance are critical, as the choices made during this period will influence both the immediate and long-term trajectory of her life. Upon confirming her pregnancy and beginning medical care, Maya faced the reality that she would need to decide whether to continue the pregnancy, consider adoption, or explore termination. Each option carries emotional, legal, and social implications. Understanding these pathways objectively, without pressure or judgment, empowers young women to make choices aligned with their values, circumstances, and long-term goals. Parenting is often the first option that comes to mind. Choosing to raise a child requires a deep commitment of time, energy, and resources. Maya considered her family situation, support network, financial stability, and educational goals. She realized that parenting while continuing her education would be challenging, but not impossible with careful planning. Parenting requires access to healthcare, emotional support, and often financial assistance. Community programs, mentorship initiatives, and family involvement can significantly ease the journey for young mothers. Maya also learned that parenting involves emotional preparation, developing patience, resilience, and the capacity to provide a nurturing environment. Adoption is another option, offering the possibility of carrying the pregnancy to term while ensuring the child is raised by another family. Maya learned that adoption can be open or closed, depending on the arrangement, and each type has different implications for contact between the child and birth mother. Adoption requires careful consideration of legal processes, counseling, and emotional readiness. Many young women find comfort in adoption, knowing that the child will have the opportunity for a stable family environment. Educational guidance emphasizes that adoption is a responsible and valid choice, one that involves planning, reflection, and access to supportive services. Termination or abortion is a legal option in many regions and may be appropriate, depending on the young woman's health, personal circumstances, and timing within the pregnancy. Maya explored this option with a trained counselor, learning about the procedures, potential physical and emotional implications, and legal requirements. Counseling ensures that the decision is voluntary, informed, and safe, with support provided before, during, and after the process. Understanding the medical, legal, and emotional aspects of termination allows young women to make a choice aligned with their personal values and circumstances. Professional counseling is a critical component of decision-making. Maya met with a counselor trained in reproductive health, who guided her through exploring each option without judgment. Counseling helped Maya clarify her feelings, weigh practical considerations, and understand her rights. The counselor provided information about available resources, such as financial aid, healthcare services, and legal support, enabling Maya to make an informed decision rather than reacting impulsively to fear or societal pressure. Counseling also addressed emotional aspects, helping her cope with anxiety, guilt, or uncertainty. Family involvement can be both supportive and complex. Maya considered telling her parents, recognizing that their reactions might vary. Some families respond with understanding and support, while others may react with fear, disappointment, or anger. Counseling prepared Maya for these conversations, helping her communicate her needs and emotions clearly. Involving family in decision-making is often helpful, but the ultimate choice remains hers, reflecting the principle of autonomy and self-advocacy. Understanding legal rights is essential when considering options. Laws regarding reproductive health vary by region, particularly for minors. Maya learned that some procedures require parental consent, while others allow confidential services. Knowing the law empowers young women to navigate their choices safely and ensures access to legal protections. Clinics and trained counselors provide guidance on regulations, helping girls like Maya make informed, lawful decisions. Social and emotional support is critical, regardless of the choice made. Each option, parenting, adoption, or termination, carries unique emotional challenges. Maya learned that peer support groups, mentorship programs, and counseling services can provide encouragement, reassurance, and practical advice. Connecting with others who have faced similar choices fosters understanding, reduces feelings of isolation, and offers models of resilience and empowerment. Decision-making also involves reflecting on long-term goals. Maya considered her educational aspirations, career plans, financial stability, and personal well-being. She realized that aligning her choice with these factors would increase the likelihood of success and fulfillment. Life planning and decision-making are intertwined. Choosing an option that supports long-term development enhances both the young woman and the child's future. Maya also explored practical considerations for each option. Parenting requires planning for healthcare, childcare, schooling, and financial support. Adoption involves legal procedures, counseling, and potential emotional support for both birth mother and child. Termination requires medical care, follow-up appointments, and post-procedure emotional support. Understanding the logistics helps young women prepare for challenges and ensures that decisions are grounded in reality rather than assumptions or fear. Educationally, it is important to emphasize that there is no right or wrong choice universally. Each decision depends on the individual's circumstances, values, and available support. Maya learned that making an informed choice after considering all factors, consulting professionals, and reflecting on her personal goals was more important than adhering to societal expectations or external pressures. Empowerment comes from knowledge, reflection, and active participation in the decision-making process. Finally, Maya recognized that choices can be revisited with guidance. Some decisions may evolve with new information, circumstances, or personal growth. Continuous counseling, support, and education allow young women to reassess their situations responsibly. Understanding that decision-making is a process, not a one-time event, reduces stress and fosters confidence in managing life transitions. In conclusion, understanding pregnancy options is a crucial stage in the journey of young women like Maya. Parenting, adoption, and termination each carry distinct implications, requiring reflection, guidance, and support. Counseling, legal awareness, emotional support, and practical planning empower young women to make informed decisions aligned with their values and circumstances. Recognizing that each choice is valid, informed, and proactive helps transform fear and uncertainty into clarity, confidence, and empowerment. By engaging with this process thoughtfully, young women take ownership of their lives, health, and futures, ensuring that their choices reflect both responsibility and self-respect. Key educational takeaways from Chapter 7. 1. Explore all pregnancy options, parenting, adoption, or termination. 2. Understand the emotional, practical, and legal implications of each choice. 3. Seek professional counseling to make informed, unbiased decisions. 4. Involve trusted family or mentors while maintaining personal autonomy. 5. Know legal rights and requirements in your region. 6. Connect with peer support and mentorship programs for guidance. 7. Align decisions with long-term goals, education, and personal well-being. 8. Prepare for practical aspects of each option, including healthcare and resources. 9. Recognize that there is no universal right choice. Decisions are individual. 10. View decision-making as a process that can be revisited with support and guidance.